New COVID cases in the tri-state region are down slightly, but the number of deaths are up and hospitalizations remain higher than ever. Today, Governor Murphy announced a new mandate for New Jersey. CBS 3 health reporter Stephanie Stahl joins us with details on that and updates from the Pennsylvania suburbs. Good evening, Stephanie.
Hi, Jessica. Well, there is some cautious optimism. Even though the numbers are really high, there is still a big emphasis on overwhelmed hospitals. And today in New Jersey, Governor Murphy announced new requirements for people who work in high-risk healthcare settings.
Governor Murphy at a new surge testing site in Galloway Township announcing a new mandate that all healthcare workers have to be vaccinated and boosted, and the elimination of a testing option.
We are no longer going to look past those who continue to put their colleagues, and perhaps, I think even more importantly, those who are their responsibility, in danger of COVID.
And while there are some encouraging trends, COVID numbers in New Jersey are still breaking records.
This 1 month has amounted to more than 1/4 of all of our cases since the start of the pandemic, with the highest daily totals we were seeing at any of the peaks of the prior surges.
Hospitals continue to struggle with the surge of COVID patients in New Jersey and neighboring Pennsylvania.
We've hit record numbers with this last surge.
Dr. Jonathan Stahl with Mainline Health joined other Montgomery County health leaders for Dr. Val Arkush's weekly briefing.
Montgomery County continues to experience an unprecedented number of cases.
In addition to handling COVID cases, hospitals are also being overwhelmed with minor situations.
We have encountered a dramatic rise in the number of emergency department visits recently. Many of these patients are very sick. However, there are a fair number of patients who are coming purely for testing. And when this happens, it delays care for patients who have true emergencies. It diverts life-saving resources.
And in Delaware County, where hospitals continue to be over capacity, thousands of volunteers with the Medical Reserve Corps are providing much-needed assistance.
Some of the biggest challenges that we have are getting patients out who need mental health care, and they wind up testing positive for COVID, so we have to keep them in quarantine until they're able to get to a psychiatric hospital, and similarly to long-term care facilities.
And now with emergency departments, people are asked to use them only for true emergencies. Right now, they especially should not be used for testing or minor concerns. Yuki?
Stephanie, thank you.